Welcome to the Heart of CIRS podcast. I'm your hostess, Melanie Joy Pensack, here to share heartfelt conversations with folks recovering from CIRS and with those special people serving the CIRS community. The podcast was created to help bring awareness to the physical, emotional, and mental experiences of folks navigating CIRS day to day. The world needs to know what CIRS folks go through for deeper empathy and understanding. Through stories and vulnerability, we can help the world understand the winding journey of CIRS recovery. Thank you for being here to open your mind and to open your heart. I'm very excited today to have a dear friend and proficiency provider diplomat on the podcast. We have Mindy Mastruserio here today. Mindy is a psychotherapist and the owner of Healing Connection Counseling. She has over 15 years of clinical experience working at multiple levels of care in the mental health field, including an inpatient psychiatric unit as a milieu therapist, a mobile county crisis clinician, a therapist at an intensive outpatient program, a psychotherapist in private practice as well. She is currently licensed to treat adult clients seeking psychotherapy in Florida, Idaho, Pennsylvania, Texas, and Virginia. Mindy was diagnosed with CIRS in 2020 and completed her training to become a Shoemaker Proficiency Partner Diplomat in May of 2023. Her CIRS journey has led her through experiences navigating hyperreactivity, tick-borne illness, and MCAS. Thank you so much for being here, Mindy. I'm looking forward to this conversation.
Thank you so much for the invitation and for having me.
Mindy and I connected through the Shoemaker listserv when I'm glad she said that she was from Pittsburgh, Pennsylvania. We also share in common that we are Pittsburgh born and raised. I want to get into your journey and experience to share with people, looking back at the years of how this all presented. What are some of the key red flags of your CIRS and hypersensitivity and tick code journey that you want to share with folks from a standpoint to maybe help them realize that they have this as an issue for themselves?
Yeah, so I think probably the first really big red flag for me was having an emergency laparoscopic cholecystectomy. And when I was 26, they removed my gallbladder. I had no indication that there was any issue before having an acute attack, and brought me to the emergency room at 4 o'clock in the morning where I just had excruciating pain. And they said, oh, you have a gallstone stuck in your bile duct and that's got to go. we got to do surgery tomorrow. It was pretty surprising. And it was surprising to them as well. They said, we don't know what this is about for you. Usually this is for ladies that are over 40, might be overweight. They asked about what my last meal had been, and I said, oh, yogurt and granola. There was nothing, it wasn't a high-fat meal or anything. So that was strange. I had signs, symptoms, looking back on it now, other things that had been, I described, whenever people ask about this, I just describe my health as being shaved off or whittled away very slowly. There were things that now looking back, I could say, oh, that was CIRS starting to take a stranglehold. But that was the first thing that really popped up. And then I had a couple knee surgeries for chronic tendonitis. I used to be a runner. So those things started to stack up in my mid-20s that were, looking back on it, very strange.
Is there anything that you want to share around your current CIRS status on where you are in the process?
So you had mentioned in my bio that I've been a hypersensitive CIRS patient, and I'm still rather sensitive. I can walk into an area or a space in a building and feel something rather quickly within a few seconds. So that still got a stranglehold, and we're really trying to peel back where that hypersensitivity is still coming from. I have struggled throughout my journey with clothing. That is the bane of where I've been at for quite some time, for the past almost 2 years, when I became very acutely ill with CIRS. So still showing up in the same outfit. I wash it every day, but again, I show up in a pink dress to all of my therapy sessions and all of my podcasts. Have had some major wins in the arena with my NeuroQuant. My NeuroQuant, I've seen massive change. I've had some major wins there. I've all but eradicated or eliminated my gray matter atrophy, which was the most significant piece and portion of my neuroquant.
Amazing.
Was in the first percentile, and now I'm mid-range, middle of the road with an average gray matter for my age and gender, which is exciting.
Congratulations. That's amazing. And I'm sure that gives a lot of people hope that there is the ability for the brain to regenerate and change. Things are not static. And I know a lot of people listening will appreciate that. And thank you for sharing really vulnerably about your hypersensitivity. I think that also validates different people's experience. SIRS is such a spectrum, right? There's people that really may not even realize they're sick and a doctor flags it and they fly through the protocol. And then there on the opposite end are people that are more hypersensitive and have tick co-infections and that make things a little more complicated. And I think it's really important that we're voicing all of that so that people can see SIRS within themselves. It's not just one way for one person. I know you and I have talked about this where sometimes we might see SIRS in people that we know and they might think they don't have SIRS because it doesn't look like in them what it's like in us. But
Absolutely.
I think it's important to highlight a variety of stories, and I try to do that with this podcast so that people can see it shows up in different ways in different people. So thank you for sharing that.
Absolutely. Yeah. And we do share that tick and co-infection layer to our SIRS journey. Was able to peel back and find that I do have an underlying Babesia infection, which is likely still driving that immune system dysregulation. I know that's a critical piece and probably part of that hypersensitivity.
Yeah, absolutely. I'd love to get to know a little bit more about your background and to share and highlight that with people. What else can you share about your background that might be interesting or helpful for people to know? What populations have you worked with and who are you working with now?
Yeah, thank you. I've worked with folks in the community with, I guess, all across the spectrum of diagnoses in the mental health field. If you're familiar with the DSM, the Diagnostic and Statistical Manual for Mental Health Diagnoses, I've seen it all. And having worked for a community mental health provider and an organization before getting into private practice. So I've worked with folks that have schizophrenia and other psychotic disorders, bipolar with mania and psychosis, personality disorders, anxiety, depression, other mood disorders. I've seen the spectrum, I've seen it all. And that has been honestly the greatest gift, I feel like, of my life. It's just being able to meet somebody where they're at, regardless of their diagnosis, frankly, and just understand who they are, how they are, why they are. I enjoy that puzzle. Again, just meeting somebody wherever it is that they're at and trying to help reduce their suffering and get them to the next space in life. So working in private practice, I see more now folks with, again, anxiety, mood disorders, a lot of trauma. I am a certified clinical trauma professional. So again, enjoy providing that psychoeducation, helping people understand what's going on with the brain, with the nervous system in order to help, again, reduce judgment and increase understanding, empathy. This isn't, when it comes to trauma, it isn't about necessarily about personality and something that somebody's choosing to do, right? These brain structures take over and the brain does what it needs to do to survive, keep the organism alive, right? So work with a lot of folks with trauma. And of course, now seeing a lot of folks with chronic illness. It's been interesting with having this new information about environmentally acquired illness, helping people to see, again, that I've worked with for maybe 5 or 6 years that have been either treatment refractory, as they call it, right? Tried multiple interventions with antidepressants, antipsychotics, mood stabilizers, going as deep as going with treatment with ECT or electroconvulsive therapy, ketamine, transcranial magnetic stimulation, right? Going to great lengths to try to assist in reduction of these symptoms. A lot of those folks end up being SIRS patients. It's, how do I want to say? It's rewarding to be able to show people that layer. But to your point earlier, it's hard when you're suffering, you're struggling so greatly with an illness to say, hey, I think this might be something that you've got going on,
Mhm.
right? I think, and what I've seen is I've been met with a lot of denial,
Mhm.
and it's crushing because part of me feels, and this is an interesting thing for the psychotherapeutic relationship, part of me feels like if I didn't have such an extreme case where I'm showing up in a pink dress every session, if I didn't have such an extreme presentation, people might be more willing to join me in that space and to explore that.
Yeah.
But I think denial shows up in the face of fear,
Yeah.
where again, it's one of our most archaic defense mechanisms that we have is to just simply say, not me. This isn't me. That couldn't be me, right?
100%. Touching on this idea too, that you have this unique knowledge now, right? So we have a lot of SIRS patients that are listening to this, obviously, but there are people outside of the SIRS world as well. This next question, if you're really speaking to people within your professional space, or even for those who are listening and have loved ones, what symptoms do you observe or what keywords do you hear now that you have this attunement that would lead you to saying, oh, we need to look into this and do a symptom cluster analysis and a BCS test?
I think it's a combination of both physical health symptoms that I hear and, of course, like a purely, what we say, purely mental health symptom, panic, intrusive thoughts. I would say like extreme presentations with depression or anxiety, anything that's rather marked, again, alongside what somebody might say is, oh, I'm having this strange physical health symptom. This is new for me. So it's less that I get one symptom that's really like a red flag necessarily. It's more of the holistic approach and perspective and seeing somebody again over the course of time, starting to report these layers of symptoms, right? We don't usually screen for or talk about, oh, I've had constipation for the past week, or I've had diarrhea for 2 weeks straight. We don't talk about gastrointestinal stuff. We don't talk about muscle aches, joint aches. We don't talk about these things necessarily most of the time in psychotherapy. But if somebody has been struggling longitudinally for months with signs and symptoms with mental health struggles, I might start to probe and ask, hey, I know we don't talk about this so much, but, and this might sound like a strange question, but X, Y, Z, A, B, C. Let me go down the symptom cluster, quick question, list of questions. But more quickly, if I'm starting to see a new patient and I start to see these symptoms be reported, I will quickly recommend a BCS to say, you know what, I know this is a different thing that might not come up with another therapist, but I would say because of my personal experience and now this additional credential that I've earned through the surviving well community. I like to provide informed consent and let everybody know where I'm coming from and what my experiences are. I'd like you to pay this $15 for a visual contrast sensitivity test, and I'll explain what this screening is for. So I'll have some people that are very interested and say, wow, this is interesting. Yeah, I'll get a results sent minutes later after a session and ooh, there we go. But I'll bring it up gently if I've not received it back and say their hesitation, what's the hesitation, what's going on here?
Fascinating. What are you noticing with the VCS tests that are coming back or any data that you've been
Uh,
tracking at this point?
yes. So I typically have a census of about 25 to 28 people that I'll see at any given time. I've had, I'd say, a little more than half of my patients return a VCS, and this is what to me has been rather shocking. I think I've had 3 that have passed VCS.
Wow.
3 at any given point in throughout a year. I think the statistics are that 1 in 4 people will have a diagnostic, will meet criteria for a DSM-5 diagnosis, mental health diagnosis. Interesting that percentage, right, overlaps with what we know with HLA, right? 25% of the population is predisposed to having HLA-DR, right? So, yeah, I'm rather interested to start collecting data from other clinicians. I'd like to get other clinicians involved trying to put together a research study with a woman from Rutgers to explore, right? Looking to have people with a DSM-5 diagnosis take a BCS and see where the overlaps are. I'm very interested also in looking at how many of those folks have struggled with thoughts of suicide, had suicide attempts. That's a particular segment that I'm very, very interested in helping illuminate. What's going on? Is there an environmentally acquired illness underlying?
I think that's groundbreaking, Mindy, honestly. I can't wait to see what unfolds as you connect with more people that really resonate with that message. I'm sure there's other clinicians out there that have people that are treatment resistant and aren't making gains or continue to decline. And the suicidal ideation piece is such an important piece to highlight too. Sometimes I feel like it's talked about like there's nothing that can be done. And what we're potentially saying here is that if there's an environmental illness underlying, that can shift and change with the correct type of treatment. And that's very empowering and I think hopeful for people.
Absolutely, absolutely. And that is the greatest risk, obviously, to someone's wellness and well-being is thoughts of suicide, plans, intent. Everything stops when somebody endorses thoughts of suicide. We can't peel back further layers until that's addressed. There's a hierarchy and a way that we have to approach these things. And so if there's not safety, psychological safety, physical safety, we can't really do more digging into what's going on. If there is an overlap with the environmental piece and we're able to stabilize somebody to the point where we can go back and look at trauma, other psychosocial issues in and around the person's life, then we can potentially move forward.
I'd imagine that someone even hearing there might be something in your environment or something that could help would provide a glimmer of a possibility.
Absolutely.
It'll be really interesting to see what type of information you're able to get together and get out there as you are working with more people in this sense. And what a gift to them to have somebody who really can understand environmental illness from the inside out to be able to help guide them in that way. Are there any stories of people that you've worked with so far that we can share with people about how maybe getting a diagnosis has given someone a glimmer of hope or helped them feel more validated in their mental health, emotional health journey?
Sure. And I do have permission from this individual to share this piece of their story. And I mentioned it on the CIRS Summit talk that we did about thoughts of suicide. Yeah. Working in Pittsburgh with folks, I had an individual who, again, was treatment resistant, had depression for many years. And it's interesting because this was the red flag that made me ask them to take a BCS. Like I said, it's usually not just one thing that somebody will report that prompts that question or that directive, but for this person, it was. He had told me that he was out with a friend. They went to this bowling alley. I don't know if you're familiar with Arsenal Lanes in Lawrenceville, not to call them out, but it's a historically, you walk in that building and you can smell it.
It's a dive.
It's a good time, but also now not so much with the CIRS diagnosis. But yeah, he had described the night was going fine and we were having a good time. And we went to this bowling alley, and within 10 or 15 minutes, he said, yeah, I nothing changed. I just wanted to die. And I said, oh, yeah, I really, really need you to do this BCS because I think this might be what's going on for you. And lo and behold, fantastically failed the BCS. We got CIRS labs drawn, blood markers drawn, and yeah, they're on their way to peel back these layers, right? Likely Bartonella infection underlying. So that was probably the most impact moment I've had in therapy with a client who, again, didn't come in with a CIRS diagnosis, didn't already have this information, but has been wondering, what is wrong with me? I think is how he said it. What is wrong with me? And so, yeah, to answer that, it's been validating to say this isn't a personality defect. This isn't your fault.
Right.
You didn't do anything wrong. You've not made the wrong choices. You've not chosen. This hasn't been your choice. But again, in the psychotherapeutic realm, it's been hard to convince this person of that, right? And to say, this is your physiology.
That's so powerful. When you start to identify these patients, is there difficulty with patient compliance, believing it, or what do you find to be like the biggest barriers with the patients in this sense? We
And I
talked
think I
about
mentioned,
denial
yeah,
earlier.
yes, absolutely. That is, I think, still the biggest. Again, for a patient coming in to see me that is not already familiar with or hadn't already identified this possibility, is trusting or believing that this is a thing. And it's interesting because they'll say, I believe you. I believe this is a thing for you. And I
Mm.
trust that you believe this. So I've seen just outright, flat out, again, denial that this is a thing.
Mhm.
But I think I've also seen it where I'm a hypersensitive person and I can feel these changes happening right away. I think for some of my patients that I see, they're hypo reactive and
Mhm.
they can go about their day pretty normally. I say normally with air quotes because what I mean by that is that they don't have the immediate implications on the physical health signs and symptoms. They don't have those immediate red flags of, hey, I'm in exposure. So I think that is I don't want to say that's a barrier, but I think it makes it more difficult at times for people to see in real time
Yeah.
the choices that they're making are exacerbating their struggles.
Yeah, I don't know how you feel about this, but I feel like having this knowledge is sometimes a gift and a curse because we have this awareness now and we can see it and see it in people. And it's really hard when people are choosing not to look into it or address it or take it any further because you care about people and you don't want them to get to the point that you are or I am. You want people to catch it early so it's like we have this understanding of how far it can go. And it's like from a deep, heartfelt place that you want people to take the initiative. But at the same time, people have their own agency and they have to come around to things when they do. I know I have to just like I plant seeds, but it's a real practice for me to have to just be letting go and letting people live their lives. It's hard.
Absolutely.
Mhm.
And in the personal realm and professional realm, I think I've talked to people about this, that I've been met with resistance. I'll gently probe and see where things are at a couple months later, especially if there's been a significant change in symptoms. But I think at one point it took somebody a year to come around and say, okay, I'm ready. I think I'm in a position, right, to start to be able to talk about this. So I've learned to absolutely respect when somebody is ready, when they're resistant, and it's like that not only with CIRS, but in psychotherapy in general, right? If somebody's not ready to work on an issue, if they're not in a space where they feel comfortable to address that with you, it's about that mutual respect. And I want somebody to come back and eventually talk to me about this. So if I've damaged the relationship such that they're just like, screw you,
Yeah.
right? Then I've lost the opportunity to help this person at all. So it is about timing and respect.
I think this is good for people to hear, even who have a SIRS diagnosis, because then they start to see it in other people and they can be going through the same experience as well, where they get met with resistance. So I think it's good to be modeling and sharing how we handle that with people, because you want people to be able to come to you when they're ready to be like, okay, or maybe I see it now, or I'm getting curious. What do I need
Mhm.
to do? If you were up on a stage, one or two sentences for your counseling psychology community, what would you want them to understand the most about environmental exposure and brain health?
But this is a thing that you have patients on your caseload, on your census that have SIRS or have prodrome signs and symptoms that suggest that this will be an issue for them.
Anywhere you'd send them to get this information to you, surviving mold.
You know what? I think that's a tough question because, I mean, personally, even on my journey, it was hard to find reliable sources of information. Yeah, survivingmode.com is a great place to start. There's a lot of data, published work on there.
I was thinking about it, like where would a psychologist go? Because I know Christian is just starting to look into some of the research that correlates together some of these tick-borne illnesses with different psychological presentations. Like there's a study that came out with Bartonella and psychosis. There's so much research out there. Sometimes you have to dig to find it. So I'm curious how does the busy everyday psychotherapist find this type of information? Maybe there's no answer to that question yet.
Well, it's a great question. I have this desire to put together a 90-minute talk.
Yeah.
Free to all that'll come, right? Have a desire to present a talk, just introducing this possibility to psychotherapists, the psychiatric community. But of course, I'm limited with my ability to do this because I'm still in and out of this survival space myself. So I'd like to eventually become a resource in my community so that people can consult and learn. But yeah, it's difficult to find these resources. I know Mary Ackerley is an amazing resource and has been doing work with folks that come to her for mental health concerns for decades now. Yeah, there aren't a lot of providers, I think, speaking out about this from the mental health space.
I have no doubt when the time is right, that will all grow. Got to take care of yourself. And all of these pieces will definitely grow into something more. I have no doubt about that. As we wind down the podcast, I want to ask you a couple questions. If you could have one magic wish granted, what would you want to see happen right now in our group?
I think I'd really love answers about actinocolonization beyond what's going on the skin, coming to poke around, I guess, in my own physiology right now and trying to identify other potential reservoirs of actinocolonization and growth, because I feel like that also might be part of this hypersensitive profile. So yeah, I know that is an area a lot of practitioners are diving into. I love it. I'm grateful for that. But yeah, if we could wave the magic wand and have answers, definitive answers as to what's going on with actinoreactivity and potential colonization, like other sources of colonization, that would be amazing.
There's a need for some deeper understanding on that level, particularly for those people that aren't kicking it. What's interesting, and a lot of us, I cycle up and down, and I see it in relationship with my tick-borne co-infection flares.
Yeah.
What is the intimate ecology and
The
relationship of these organisms within our own bodies? It's a whole world in there, and so more to come on that. And the last question is, what keeps you hopeful day to day as you continue to go through a significant presentation of this illness?
What keeps me hopeful is feeling like, I guess, I'm on the cutting edge of things, that I'm potentially helping other people by helping myself and finding out what's going on with me. If I can find out what's going on with me, I can help other people find out what's going on with them. And again, I think I mentioned this earlier, but decreasing suffering, not only for myself, but for other people, is my life's work. I've known that for some time. And so that is what keeps me motivated to keep going. And that's the hope, is that this will all be worth it in some way.
I really admire your work, Mindy. I love you as a friend, and watching you really turn this pain into purpose and helping so many people is just really a gift. So know that the work is not in vain, and you're touching a lot of hearts as you speak up about all of this and bring this out into your communities. So thank you so much for being here today and sharing. I always love talking with you. Can you share a little bit about how people can get in touch with you if they want to work with you on a psychotherapeutic level?
Absolutely. I just want to say thank you so much for the opportunity to come and chat and to share part of my story and what's going on, I guess, in this slice of time. But yeah, if anybody's interested, they can find me at healingconnectioncounseling.org.
Thank you. Thank you so much again. And I look forward to seeing how things unfold.
Thank you so much.
Thank you for listening and for your kind attention. To keep in touch, follow the Heart of CIRS podcast on Instagram. You can visit melaniepensack.com/the Heart of CIRS to donate. Your generosity helps to keep this podcast growing. May the awareness of CIRS spread far and wide, helping to change millions of lives for the better.